So I decided to split my pain videos completely into two and do each section in a different video because turns out I talk a lot more than I thought I did, and so it's a lot longer than I thought it would be. So this is the second video of mine focusing on what you can do to manage pain and deal with pain if you have it chronically, whether it be from something like hypermobile EDS or fibromyalgia, or just kind of whatever, and you find yourself looking for ideas. Now, the first video was about non-medication ways to help manage your pain. This one is about different medicine options. So as I stated in the other one, as I will probably state in every single video, I am not a doctor, I am a patient, okay? So everything that you do, especially with medicine, needs to be monitored and checked with a doctor, okay? Do not just take what I say and just go and do it. That's quite dangerous. Medicine is obviously something that you need to be careful with. There's not any shame in taking medicine and taking painkillers because you have a pain condition. Obviously, at the moment, there's a lot of things in the press about the opioid crisis, and certain doctors and surgeons are really scared about prescribing stuff, and there's quite a lot of scaremongering out there. And kind of stigma around whether you need to take medication or not. In my opinion, that's absolutely fine. It doesn't make you a weak person. If anything, again, like mobility aids in the other video, in my opinion, it makes you strong, because to accept that you need that extra bit of help and taking steps to handle that, especially when there's such a harsh stigma around it, in my opinion, makes you strong. And I think a lot of us, it really is the last place for us to turn, especially mentally. If our chronic pain is something that is not handled, it could end quite badly. So this is kind of the medicine section. And the reason that I feel it's important to do a section like this is because, as I said in my other video, I've heard from people who have been told by their doctors, pain medication will not work on you if you have hypermobile EDS. There's nothing I can do for you. There are no options out there, is kind of thoughts and prayers. Which makes me really angry that people have been told this, because this is absolutely not true. There are medicines out there that can help you. So I just wanted to go through the different types, because there are so many different types of pain medication. There's not kind of, people just think you get one block of pain medication. If it works, it works. If it doesn't, it doesn't. There are so many different types that I think people just need to be aware of. And the more knowledge you have, the more knowledge you can take to doctors. I'm going to do another video about how to deal with doctor's appointments and hospital appointments, because I know that's something that a lot of people get a lot of anxiety about, especially due to past trauma, and just the best way about going about them. So, options. So there are certainly, I would say there are 1, 2, 3, 4, 5. I would say there's 6 general categories of pain relief. The most common is something called NSAID. This is NSAID. Okay, these are your typical non-steroid anti-inflammatory. Okay, so these are your things like ibuprofen, diclofenac, naproxen. So this is your typical anti-inflammatory. Now, when doctors say painkillers won't work on you, I think this is what they're talking about, because according to the doctors that I've seen, because especially with hypermobile EDS, it's not actually an inflammatory issue, as most of you will have had your inflammation markers checked and they will have come back completely fine. So because the hypermobility isn't an inflammation issue, it may not help deal or treat your chronic pain. However, I find that if I have pain on top of my chronic pain, that could be a headache or period pain or something like that, that isn't an inflammation issue, that taking a Nurofen or an ibuprofen on top does help with those specific issues. So that is your first category of pain relief. The second is, this is the big one. This comes under opioids and analgesics. So this is when certain people's alarms start going off, people start getting a bit cagey. So this is things like your morphine, your tramadol, your oxycodone, your codeine, things like that. There is nothing wrong with taking opioids to deal with your chronic pain. I'm on tramadol. I think it personally has saved my life. I'm happy to admit that. I do not think I would be here if I had not been put on tramadol. And that does not automatically mean you are a drug addict, that you're a junkie, because I know that a lot of people have really, really harsh opinions on opioids, and I personally think the press make it massively worse. So just to let you know, that option is out there, and that it might work for you, and that's obviously a decision that you need to make if it's something that you want to do, or something that you don't want to do because you are concerned about something like addiction, which is completely fair and justified if addiction is something you've struggled with in the past. So again, this is me just giving you options and letting you know the options that are out there, and then you making an informed decision on your own about what is the best treatment for you. The next is pronunciation. Things like cortisone shots, basically, and prednisone shots. So quite a lot of people have cortisone shots directly into areas like their shoulders or their backs. I don't know much about them. It's not something I've had, but just letting you know, there are the steroid shots out there. People do use for pain relief, so that's kind of your third option on the list. Muscle relaxants, so these are your things like Norflex, Flexeril. Again, it is quite self-explanatory. This is kind of helping to relax your muscles to hopefully reduce the pain caused by being so uptight and tense. So that obviously works as a painkiller, kind of the muscle relaxants. And then the next kind of section is your anti-anxiety, antidepressants, anti-convulsants. So these do actually occasionally have, specific ones do have pain relief side effects, just as part of the drug. And I think that's not as known by people. People are surprised that the drug can do two things. So you've got your anti-anxiety things like alprazolam and diazepam. They're kind of more well-known ones. Your antidepressants such as amitriptyline, duloxetine, which is also known as Cymbalta. So remember, you have the medicine name, so for example, duloxetine, and then the brand name, Cymbalta. So people will talk about the same things but with different names. And then you have your anticonvulsants such as pregabalin, which is it's like Lycra, Lyrica, and gabapentin, okay, which is the name for Neurontin. So it's just to let you know that these things are out there. Sometimes they kind of combine to solve several issues. So for example, I was on Cymbalta for quite a while for the mental side and the pain relief side. So Cymbalta worked for me for quite a while. But obviously, just because it worked for me does not mean it will necessarily work for you. Again, this is all individual. And then, unfortunately, my pain levels went up, so I needed something more substantial than Cymbalta. I did try amitriptyline several years back, and that's an example of one that works for so many people, did not work for me. I was like an aggressive zombie, is the best way to describe it. It was really weird. So yeah, it's just letting you know that there are medical pain relief options out there, and that don't feel just brushed off and disheartened when you're told that there aren't any options, because there are options out there. Another one that's often given to people with fibromyalgia is something called Savella, Savella. I don't know why it's particularly prescribed to people with fibromyalgia. I don't know. I just know that it is something that is available. And then obviously you've got paracetamol, which is kind of in a category of its own because it's not an anti-inflammatory. Some people accidentally put it in with the non-steroid anti-inflammatories, and it's not, because it's not massively, doesn't massively have anti-inflammatory outcomes. So, for example, you might be on a mix of things, so mine's tramadol and paracetamol combined. So yeah, they're basically, that's a quick version of all the kind of options that you do have. Again, you know, take care, do this with medical professions and doctors, and, you know, take care when taking them, take your time. I have personally gone through quite a bit with different medication, whether it be withdrawing and switching medicine from one to another, or finding out that actually, oh no, I'm allergic to this particular medicine. And it can be quite a tough path. I had a couple of months of trying to switch my medicines around earlier this year, and the side effects were not good at all. But now that I've settled down, you know, I'm really glad that I have medicine options and that I'm taking them. So yeah, just, you know, take this as information gathering, and obviously do your own due diligence and investigation with it. So thank you for watching.